Hello, everybody. So this is our long-awaited MRCS ENT Success Course orientation session, in which we will tell you about MRCS ENT exam and also about MRCS ENT course. Our course, MRCS ENT Success Course. So first of all, regarding MRCS ENT exam, this exam is an exam which makes you eligible to work in UK, and you will be eligible to get a GMC through that, as well as you can work, you can also appear for the FRCS international exam. So it is really a very good exam if you have a dream to work in UK. Now I will tell you about how to give this exam. So I will give you some course recommendations. So for this exam, MRCS ENT exam, the requirement is that you should have already passed MRCS Part A exam, which is done in general surgery. Okay, and for that, we do have a recommendation as many people ask us. So Dr. Abu Umar is running since last 5 years a very successful course by the name of MRCS Scholars, and his web link is also I have attached. So you can contact him, and he has a 99% success rate, and many candidates are very happy with his course. So if you once you have cleared this exam, then you can contact us, and 3 months before the actual exam you should join our MRCS ENT success course. And we are very active on social media. We have 3 different accounts: Facebook, Telegram, and WhatsApp. You can join them, and if you have any, they are all free groups. If you have any queries related to our course, we are more than happy to answer you, and we can guide you regarding this course, as well as any queries regarding this exam. Okay. So as I told you that this exam has 2 parts, you cannot give this exam directly, because many people who are ENT postgraduates, they think that directly they can enter into this exam, which is the MRCS ENT OSCE exam. No, they have to clear the MRCS Part A first in general surgery. After that, they'll be eligible for this MRCS Part B ENT exam. Some general idea about this exam. This exam happens 3 times in a year, and 2 times in UK and 1 time in Ireland. And these are the 3 months, February, May, and October, in which this exam happens. And you have to book it earlier if you're interested. And once you book this exam, you should join some course, because you cannot pass it with your self-study. It's really difficult with the busy schedule with which all the doctors have. Okay, now I will tell you, this is also very important query, that how to book the exam. We have passed it with some other college. So if you have passed the MRCS Part A exam, you can book with the same college, as well as any of these 4 colleges. You can book your exam, no problem. Okay, you can book it through Glasgow, you can book it through Edinburgh, you can book it through England, you can book it through Ireland College as well. And now once you have booked the exam, I will tell you that this exam has 2 parts. Because of the COVID situation, this exam has been changed. Before, it used to be a one day exam, but now it has been divided into 2 parts. One is the online exam, which is also called the non-manned stations. Okay, and in which there will be 20 questions, and each question will have 7 minutes, and you have to answer this, and you can easily give it remotely with your laptop. It's not mandatory that you should be in UK to give the exam. You can be in your own country. And once you clear this exam, then after 2 days, 3 days, or 1 day, you will be called for a in-person exam or man station exam, communication skills. Okay, and now before telling you about the exam more, I would like to tell you about ourselves, a brief introduction about our course. MRCS ENT Success Course is a purely online course, so it is very suitable for the busy doctors. They can easily, through their laptop or Android phone, they can book us and they can avail us. Our course covers the high yield and commonly tested areas in the basic and clinical knowledge, communication skills, examination, and assessment. And there will be live interactive Zoom classes, there'll be mock tests, revision classes. Everything is included in our course. So first of all, regarding our course supervisor, he's a very well-known doctor, Dr. Ricardo, who is a consultant ENT surgeon from UK. He is FRCS ENT. Not only he do this, our course supervisor, but he also runs the FRCS international course as well. If you have any queries regarding that, you can ask him. And I will tell you more about Dr. Ricardo Persaud. Everybody is familiar with the ENTs are. This is his own website, and he has 9 ENT. He has written almost 9 ENT books. Okay, and this is his famous book for the MRCS ENT exam. So I've pasted it over here so that you can be familiar with that. This Dr. Ricardo Persaud is our course supervisor, who is the founder of ENT ZAR as well. So that means that all our material is pre-tested by him, and all our communication skills which we will teach you in our course, that all has been taught by him to us. And now our course coordinators, I am Dr. Binish Kaval. Then we have Dr. Poonam Singla, Dr. Seher Naseem, Dr. Haris Hassan. All of us, we have already passed MRCS ENT exam through different colleges. We were all trained by Dr. Ricardo, and we are all running this course successfully. Now, yes, Dr. Poonam will tell you more about our course.
Yeah, hello, I'm Dr. Poonam. Now I will tell you a little bit in more detail about unmanned stations. So as Dr. Binish has told you, in unmanned station, there will be 20 stations, okay? And for each station, you will be given 7 minutes to finish. And in each question, you may have subparts. Usually, there are 5 to 10 subparts of each question. So you have to be really very fast in answering these questions, okay? So in unmanned stations, the exam cover different aspect of ENT. Like you should have very good knowledge of anatomy. The frequently asked question is like foramina. They will give you skull-based pictures. You have to identify different foraminas, the structures passing through these foraminas, temporal bone pictures they give from different angles. Okay, you have to identify like which impression this is showing, which structure passing through this, and what is this. And histology also, they ask very frequently question from histology also. And head and neck, in head and neck they give frequently this cadaver pictures, and you have to identify normal structures in those cadaveric pictures. Otology is, as we know, it is very important sub part of our specialty. Rhinology also. And audiology becomes very important, as in our training days we give less focus, less attention to audiology, but for UK people it is very important, and they ask many questions from audiology. So you should have detailed knowledge of audiology. They frequently ask different type of audiograms, different type of tympanograms, and really the question which they ask are tough, and you should means you can answer those questions only when you have detailed knowledge in audiology. And radiology, yeah, this topic is also very important, because for last 3 years they are repeatedly asking different questions from radiology, like CT scan, MRI. First you have to identify whether it is CT scan or MRI. In MRI they are asking whether it is T1 weighted, T2 weighted, T1 with contrast. Then they are asking what is the diagnosis, what are the features, clinical features, what will be the treatment. So if you don't know the diagnosis, what the picture is showing, your rest of the question will automatically get wrong. So to answer these questions, you should have really good knowledge of radiology. And in our course we give special stress on radiology. In our discussions also we discuss a lot this radiology part. And this transfer and discharge letter, this is a fixed question, and we teach this also in UK style. Next, Dr. Binish. Now this manned station, yeah, all of us should be very trained in manned station, because for manned station you have very less safe margin. Okay, you have to be really very perfect in communication skills, that too in UK style. Okay, and for each station there will be 4 stations for checking our communication skills. And each station 7 minutes will be given to cover each condition. Like the different scenarios which are given in the exam are breaking bad news, history taking, with or without examination, consents and explanation. Okay, so means you have 7 minutes only to finish, suppose, breaking bad news. So you should have really a very good practice to finish each and every aspect which they want from us. And we give special stress on this communication skills, that too in UK style. Next, Dr. Binish. So now these are few pictures from our course, which just for an example, we have added. So this picture, like they will ask, what is this picture? What is the type of scan here? Whether it is corneal or axial. Okay. For MRI, they are asking whether it is T1, T2, or T1 with contrast. Now they will ask, what is the diagnosis? They will ask, what are the clinical features? What is the phenomena associated with this condition, and what is the management? So this question is very frequently asked in last few years. So you can imagine like what type of question are they asking from radiology. And another picture, same, just asked in our last exam. This picture they are asking, like this picture, the patient is having history of lethargy, headache, and blood investigation is showing hypercalcemia, and this is the scan. So you have to identify what is the picture, what is the possible diagnosis, and what other radiological investigation you will do to aid the localization. So you should really have good knowledge of radiology to answer these type of questions. Next. Yeah, this is also asked in just last to last exam. So here the scan, you have to identify like what type of scan is it, what is the diagnosis, what is the most likely source of infection, what are the complications. So all your answers, second, third, fourth, fifth answers will depend on your first question. If your diagnosis gets wrong, so your other parts will automatically get wrong. So you should really have good knowledge of radiology to answer these type of questions. And we are giving very stress, very much emphasis on this radiology part. And this is another question in which you like the patient, the endoscopic picture is showing of eardrum is along with granulation. So here the patient is presented with the chronic bloody ear discharge. So you have to identify the photo, the diagnosis, three investigations, three complications. Like this, they frequently ask, name three investigations, name three complications apart from bleeding and infection. So here you can see this question has 6 parts, and you have 7 minutes to answer this question. So roughly you have almost 1 minute for each subpart. So when you will write down the answer, three investigation, three complication, you don't have much time. So everything should be on your tips to answer these type of questions, and that's what we are doing in our course. So yeah, this is also very important picture. Now you have to identify like what is this scan, whether it is CT scan or MRI, and whether it is T1 weighted picture or T2 weighted picture, and what are the radiological findings here in this picture, and what are the clinical feature of the patient, and what is the diagnosis. So this question has been asked in last 2 exams, previous exams. So uh, now you can imagine how much the radiology is important. Now Dr. Binish will tell you regarding our course, why our course you should opt for our course. Yeah, Dr. Binish.
Yes. So Dr. Poonam has given you a a little bit window. She has given through our course some pictures she has shown which are really very important. So you must have got some idea. But still, how our course is different from others, that they are. What I came to know, that all courses they are taking live sessions only for communication part. Okay, but here how we are different from others, that we are taking 2 live sessions per week, one on communication and one on the written part. Why? Because written part also sometimes you don't understand the pictures, you have many questions, but you cannot ask the tutors because they are not actively present. So this is the most different point which we have, that we are taking both live interactive Zoom sessions, one on communication, one on the written stations. Then we give you all the tips and skills for acing exam will be provided. Then the communication skills, you will find many courses, but they are not UK style. They are not optimized according to the UK style. So that's why usually most of the candidates, they fail in the communication skills, because the other written part, they may pass it through their previous ENT postgraduate knowledge or something like that. But the communication skills, they have never practiced with the UK style. So that's why the more what we have seen, the failing rate is in the communication part. Then our material is also very authentic. Otherwise, you can find a lot of material online also, but our material is authentic. And we have also added it, and we keep on upgrading our material with new questions. And also in the last 2 years, they have changed the format. They have added many new questions, which we have already incorporated in our course. And other than that, since we are four tutors, four doctors, so we give personal attention to all candidates. Our exam is course is exam oriented and focus study. It is not too much extensive that you can get lost into the books, because you all are doing busy scheduled duties, on call duties, so it's easy. And all your queries and difficult questions will be discussed in the groups, and special focus on radiology and histology, as Dr. Poonam has already told. And most importantly, that past recalls or past questions, that we found that they were not available with any of the courses, but in our course in the last month, we are just discussing the past recalls and past questions, and we are taking a very good revision in the last month. Other than that, we are very good in taking mock tests. We take mock tests after each chapter, after each topic that is finished, and also we take a lot of mock exams at the end of the course. And during, just before the exam, we take two mocks. Okay. So, and we also have a very good passing rate, 100% passing rate for the last MRCS ENT exams. So if you are interested, my WhatsApp number is also given, and my name is Dr. Kaval. You can contact me regarding the registration process. And our FEB classes are starting from first week of November. So we have already explained that we all are UK experienced, and why you should choose us. Our course is very much exam oriented, and number one thing, that it is ideal for the busy doctors, because with their busy schedule they can easily join this online course. So if you have any other questions, we are very happy to answer them. You can message us in our active social media groups. So thank you. Thank you.